Hello.
Hi.
My name is Jocelyn. I'll be doing your assessment today.
Okay.
Okay, so first we'll start off by looking in your ears, okay? So I'm just going to look at your ears here. And your ears appear to match the color of your face, and they're freely movable. I'm checking if you have pressing here. You tell me if you have any pain over here. So no pressing by the mastoid, there's no pain there. And I'll be looking at the other ear. So same, matches the skin color of your face, and it's freely movable. Any pain there?
Nope.
Good. So now I'll be looking inside your ear, okay? So there appears to be no lesions. Inside the internal canal appears to be pearly gray. Now I'm going to ask you to, I'm going to assess cranial nerve 8. I'm going to ask you to take your left hand and put it in your left ear, and I'm going to say a sentence and you're going to repeat it, okay? So wiggle in your ear. The dog jumped over the log.
Dog jumped over the log.
Good. And do the same thing with the other ear. The book fell on the floor.
The book fell on the floor.
Very good. So now I'm going to do the Weber test by using a tuning fork. So I'm going to strike the tuning fork and place it in the base of your skull, and you tell me when you hear the ringing, or if you hear the ringing more so in the left ear, right ear, or equally in both, okay?
Correct. Equally.
Good. Okay, now I'm going to do the rhyme test by testing bone and air conduction, okay?
Right.
So I'm going to, when I strike the tuning fork, I'm going to place it by the mastoid bone,
Right.
and you tell me when you hear the ringing stop, and then I'm going to place it by your ear, and then you tell me when the ringing stops, okay?
Stop. Stop.
So do the same thing on the other side.
Stop. Stop.
Okay, good. So air conduction should be twice as long as bone conduction, and it was. So now I'm just looking at your nose, and it appears to be symmetrical, midline, and there's no deviations. And then I'm going to look inside your nose, okay? So I'm going to ask you to tilt your head back. Very good. So her internal nose appears to be glistening pink with no lesions, and the septum and turbinates appear to be the same color. Now I'm going to be looking at inside your mouth, so I'm just going to put on some gloves, okay? Mouth, and when she clenches her teeth, appears to be symmetrical. And just clench your teeth again. Okay. Gums appear to be pink. Okay, good. And I want you to open your mouth and use a flashlight to look inside. Pupil mucosa appears to be pink and smooth with no abnormalities. Now I'm going to assess cranial nerve 9. So I want you to open up your mouth, stick out your tongue. Okay. And say, ah. Sorry. So uvula is elevating as she opens her mouth wide. Now I'm going to be assessing cranial nerve 12. So I'm going to just be moving your tongue, okay? No lesion on your tongue. And now I'm going to ask you to push your tongue against. So that's cranial nerve 12 with movement and strength. She has good movement and strength in her tongue. So now I'm going to evaluate cranial nerve 5 and T and J by assessing your jaw. So I'm going to press here and have you open in your mouth. Okay, good, and close. Good. So no, I don't hear any or feel any clicking or popping in her jaw. So now I'm going to be assessing your eyes, the visual acuity. So I'm going to use the Snellen chart that's on the wall behind me here. So I'll be assessing cranial nerve 2. So I'll ask you to cover your right eye with your right hand and tell me which line you can read, the smallest line you can read.
Second to the bottom, L, D, C, Z, O, T, E.
Very good. And can you cover the left eye? Good. And read the same line backwards.
E, T, O, Z, C, D, L.
Very good. Okay. So now I'm going to be looking, just inspecting your eyes. So there doesn't appear to be any periorbital edema or swelling. The eyelids, can you close your eyelids? Good. So no tremors when she closes her eyes, and there's no redness or swelling there either. So I'm going to be assessing your lacrimal ducts. I'm just going to pull down your eyelid, okay? Okay, so the lower lacrimal ducts and conjunctiva appears light pink, and the sclera is white. So now I'm going to be assessing your pupillary response to light and accommodation. I ask you to look straight ahead. So pupils are equal, round, reactive to light. And now I'm going to be testing accommodation. So I ask you to look at the wall behind me. Good. And now focus on this pen light. Very good. So as she focuses on the pen light that's closer to her, her pupils constrict. And that's a normal finding. So now I'm going to evaluate cranial nerves 3, 4, and 6. So I'm going to ask you to follow the pen light with your eyes only, okay? Keep your head straight. Good. now I'm going to assess cranial nerve 7 by having you raise your eyebrows, good, and close your eyes shut tight. Very good. So now I'm going to inspect the inside of your eyes with the ophthalmoscope. So I'm assessing cranial nerve 2. So just look straight ahead, okay? So pupils appear to have a red reflex with no black densities. And then, okay, can you look at me now? Okay. Can you look at me now? Good. So when I look inside her eye, the fundus appears to be yellow to red pink, and the optic disc has a yellow ring surrounding it. So now I'm going to just inspect her this scalp and hair, and bone configuration of face and skull. So her bone, or her head is up, straight, upright, and still. And I'm going to palpate the hair and the scalp. Okay. So there's no deformities, no lesions, and her scalp moves freely, and no depressions. The hair appears to be appropriate for her gender and age. So now I'm going to assess cranial nerve 7 by having you smile. Okay, now frown and puff your cheeks. Good. And I'm going to auscultate your temporal arteries. First, I'm going to palpate. Okay. Okay, so now I'm gonna assess the position of your trachea. So that appears to be midline, with no tracheal deviations to either side. And then right now I'm going to palpate and auscultate the carotid arteries. So assessing one at a time. So now I'm going to palpate your lymph nodes. So I'm going to start going to start back here. So I'm feeling there's no nodules. I don't feel any back here in the occipital. And then the preauricular in front of the ear. I'm going to palpate the submandibular. Okay. Or submandibular, submental. It's here. Posterior cervical by the trapezius muscle, and superficial cervical in the neck here, and deep superficial and subclavicular. So there's no palpable lymph nodes, so that's a normal finding. So now I'm going to ask, I have to observe your thyroid gland, so I'm going to ask you to first take a sip of water and put your head back. Okay, so thyroid is not visible, and that's a normal finding. And now I'm just going to assess palpate the thyroid. So the thyroid appears to feel pliable. No, any tenderness there?
Mm-mm.
Non-tender. And now I'm going to feel any heavy swallow. Okay. So as she swallows, the thyroid moves appropriately, and no nodules were noted. Okay, so I'm gonna step out, and I'll have you just change so you don't have your shirt. Okay.
Okay.
Take your shirt off, please.
Yes.
Okay. Okay, so I'm just going to be looking at your chest while you breathe normal.
Okay.
So as she's breathing, her chest is rising symmetrically. She's not using any accessory muscles during inspiration and expiration. So there's a nice equal rise and fall. So I'm just going to place my thumbs at the base of your chest here. Okay. So my thumbs diverge equally with respirations. And then I'm going to have you turn this way. I'll look at your back. So same thing, just breathe normal. Okay. And then I'm going to place my thumbs back here.
Okay.
So take a deep breath. Okay, so same thing in the back. My thumbs diverge equally. So now I'm going to have you turn to face me again. And now I'm going to palpate. Okay? Okay, and have you turn that way. Okay, very good. I'm gonna palpate for tactile fremitus. So I'm gonna have you say 99 as I press on your chest, okay?
99, 99, 99, 99.
Okay, can you turn the other way? Do the same thing on the back, okay? 99.
99, 99, 99,
Cut off.
99. Oh, it's still green. It's still green, so it's fine.
Sorry. So I felt the most vibration between the second intercostal where the bronchi bifurcate. So now I'm going to percuss. Okay. Let's do some tapping on your chest.
Okay.
Okay, and I'll do the same on your back, so we turn that way. Okay, you can face me again. Okay, so now I'm going to listen to you, okay? Okay, listen to your back. Okay. So I have to percuss on your right flank, so I have you raise your arm up. Yep. Okay, and same thing on the other side. Okay, good. And you can stay on that side. I'm going to take a listen too. So when I percuss over her ribs and heart and diaphragm, I hear dullness and resonance over her lung sounds. So I'm gonna good. And listen to the other side. Very good. So her lung sounds clear all throughout her lung fields. And when I estimate her AP diameter, so it appears to be 1 to 2. So now you can face me. I'm gonna inspect your neck veins. So there appears to be no evidence of JVD. And when I inspect her precordium, that appears to be normal. So now I'm going to auscultate. First, I'm going to listen to you sitting, and then we're going to have you lay down, and then lay on your left side, okay? So let's have you lay on the bench over here. Turn this way. So first just lay down. And then can you lay on your left side? Yeah. Okay, and now I'm just going to palpate for the point of maximum impulse, and that should be at the apex. So I did feel that. And while palpating, I did not feel any thrills or heaves at all. That's it.